the healthcare information exchange is extremely important, but until stricter security models are put in place, we're not going to be able to accomplish that. If you hear some of the speeches on this conference, people are mentioning that HIPAA is not enough to enforce security. We, as a vendor that works with the Department of Defense, are subject to much stricter security regulations that not only have to do with keeping audit trails within the application, it's also keeping audit trails on the operating system, it's keeping security clearance for the employees that you have that are dealing with patient data, and at the same time, the protection of your organization in general, so you cannot have people from the outside coming into your company and looking at patient data. So I think that the legislation that is being proposed, I think that is going to help a lot on the area of interoperability, on healthcare information exchange, but I think that when it comes to security, there is definitely much more that can be done. And I think that if there is a time for the government to play an important role, is in healthcare, and this is the time, because without the help from the government, it's going to be very hard for the healthcare organizations to realize that the time frame that exists will not allow them to make the same mistakes that they have been doing for the last 15 years, which is looking for a big monolithic vendor solution to cover all areas of the hospital. Now the government has a specific funding level that only covers for those areas that today are not fully automated, where you actually you benefit from having the most clinically relevant data, meaningful data, that is going to support the overall concept of meaningful use.